Okay, thank you all for coming, and I want to thank our panelists for what is going to be a very important hearing. The rules will be that I will make some opening remarks. Senator Burr, the ranking member, will make some opening remarks. Members will have 3 minutes, and I will keep people to 3 minutes because it's going to be a long hearing. We're then going to go to Secretary Shinseki and Undersecretary Petzel. We have an excellent second panel made up of service organizations. We look forward to hearing from them. We have a very good third panel as well. So it's going to be a long hearing, and we're going to get through it. Let me begin by just making a few basic points. Very serious allegations have been made about VA personnel and their doings in Phoenix and in other locations. I take these allegations very seriously, as I know every member of this committee does, which is why I have supported an independent investigation by the VA Inspector General. As we speak right now, the Inspector General's office is in Phoenix doing a thorough examination of the allegations, and my hope is that their report to us will be done as soon as possible. And what I have stated and repeat right now is that as soon as that report is done, this committee will hold hearings to see what we learn from that report and how we go forward, as soon as we possibly can after their investigation is completed. I think there is no member of this committee who disagrees, and nobody in the United States, that this country has a moral obligation to provide the best quality care possible to those who have put their lives on the line to defend this nation. And I believe that every member of this committee will do everything that we can to get to the truth of these allegations. But if we're going to do our job in a proper and responsible way, we need to get the facts and not rush to judgment. And one of the concerns that I have, to be very honest, is there has been a little bit of a rush to judgment. What happened in Phoenix? Well, the truth is we don't know, but we are going to find out. Now, let me say a word about VA healthcare in general, which is what this hearing is about. What we want to know about VA healthcare is what is going well and what is not going well. And in terms of what is not going well, how do we improve that? Today, we must understand that when we talk about VA healthcare, we are talking about the largest integrated healthcare system in the United States of America. VA has 150 medical centers, has over 800 community-based outreach clinics, and some 300 vet centers. Every year, the VA is serving 6.5 million veterans. Today, tomorrow, and next week, every single day, VA serves more than 200,000 veterans every single day. Now, what does that mean? And here's my point. If Senator Burr and I were to run around the country and visit every VA medical center, this is, I suspect, what we'd find. You'd find people coming out and they'd say, I got pretty good health care. I like my doctor. I was treated courteously. And then we would find people say, you know what? I had a bad experience. I didn't like my doctor. The point that I want to make is that when you are dealing with 200,000 people, if you did better than any other health institution in the world, there would be thousands of people every single day who would say, I don't like what I'm getting. And we have to put all of that in the context of the size of VA. Does VA, in general, provide good quality care to veterans? Simple question. The answer is that some people think that it provides very good quality care. The American Customer Satisfaction Index ranks VA's customer satisfaction among veterans patients among the best in the country. And if you go out and you talk to veterans, generally speaking, I tell you in Vermont, not 100%, people say, yeah, we get pretty good health care. Not perfect. Are there problems? Absolutely. And we're going to talk about those problems. The National Commander of the Disabled American Veterans, and these are folks who are dealing with people who have service-connected injuries, people who were hurt in war, said this before the committee in February, and I quote, "Across the nation, VA is a model healthcare provider that has led the way in various areas of biomedical research, specialized services, graduate medical education and training for all health professions, and the use of technology to improve healthcare." DAV went on to say, "Such quality and expertise on veteran-specific health needs cannot be adequately replicated in the private sector." The Paralyzed Veterans of America today will testify, and I quote, "The simple truth is the VA is the best healthcare provider for veterans. In fact, VA's specialized services are incomparable resources that often cannot be duplicated in the private sector." Today, the president of the National Association of State Directors of Veterans Affairs, representing all 50 states, will tell us, quote, "The state of VA healthcare in our nation is strong." Further, and here's another point that has to be made, and I know that it doesn't fit within a 12-second soundbite, but this is a point that has to be made. There is no question to my mind that VA healthcare has problems, serious problems. But it is not the case that the rest of healthcare in America is just wonderful. Everybody walks in, gets immediate care, gets great care at no cost. It's all affordable. That's not the world we live in. And let me give you one example of that, because it is important to put VA healthcare in context. A Scientific American article, September 20th, 2013, less than a year ago, states, quote, "How many die from medical mistakes in U.S. hospitals? An updated estimate says it could be at least 210,000 patients a year, more than twice the number in a frequently quoted Institute of Medicine report. Hospital errors that cause death are now the third leading cause of death in America behind cancer and heart disease." What does that mean? Have deaths been reported through medical errors in the VA? The answer is yes. And every one of those deaths is a shame and something that we have got to address. But it's not just the VA. Third leading cause of death in America are medical errors in hospitals. That's an issue we have to address. Now, having said all of that, trying to put this debate in a context, there is no doubt in my mind that there are serious problems facing VA healthcare, and we have got to do everything that we can to address those problems. Let me just discuss a few. Does the VA have adequate staffing? When we talk about patient wait times, which is a major, major concern in certain parts of the country, and this issue just came up the other day in Phoenix, where a town meeting was held by the American Legion. The issue of wait times came up. Is the VA adequately staffed? Do we have enough doctors and nurses in various parts of the country? I don't know the answer to that, and that I want to find out. Further, is the VA doing a good job in allocating its resources to where the staffing is needed most? There are some places in the United States where VA load is going down, fewer people are coming in, other places where it is increasing. Are we allocating resources appropriately? And let's remember that in the midst of all of that, we are dealing with 200,000 men and women who have come back from Iraq and Afghanistan with PTSD and TBI, not easy problems to address. A few years ago, VA changed their wait time measure to an ambitious 14 days. If you call up, you're going to get in 14 days. Was that appropriate? Can they accommodate that with the level of staffing that they have? We need to discuss that. And what happens to those facilities that are unable, in fact, to bring patients in within the 14-day period? Is it possible that in some cases, unrealistic expectations have created a situation where some staff is, in fact, cooking the books? I want to look at that. So with that, I look forward to this hearing to get at the root of some of the healthcare problems facing the VA. And with that, I want to give the mic to Ranking Member Senator Burr.
Thank you, Mr. Chairman. Thank you for calling this hearing. Secretary Shinseki, welcome. And to all the other witnesses today, thank you for your willingness to be here with us. The issue before the committee today is the state of VA healthcare system, which we have a sacred obligation to ensure that those who have fought for this nation receive the highest quality of services from the Department of Veterans Affairs. Now, in the Chairman's opening remarks, he was correct. We're not here to analyze a poll that was taken about the VA. But we are here rather to look at the investigations that have already taken place and addressed certain deficiencies within the veterans system that no action was taken on, or at least not corrective action. In fiscal year 2013, VA reported that 93% of specialty and primary care appointments and 95% of mental health appointments were made within the 14 days of the patient's or provider's desired date. At first glance, these numbers appear to demonstrate that veterans are receiving the care they want when they want it. However, we know this is not the case. I think if VA had asked hard questions regarding these statistics, we would not be here today discussing recent allegations surrounding many, and I stress many, VA facilities. More specifically, we're here to discuss today when senior leadership in the department became aware that local VA employees were manipulating wait times to show that veterans do not wait at all for care. It seems that every day that there are new allegations regarding inappropriate scheduling practices, ranging from zeroing out patient wait times to scheduling patients in clinics that don't even exist, and even to booking multiple patients for a single appointment. The recent allegations were not only reported by the media, but have even been substantiated by the General Accounting Office, the Inspector General's Office, and the Office of Medical Inspector. Here are a few examples. The GAO released a report on the reliability of reported outpatient medical appointment wait times and scheduling oversight in December 2012 and has testified multiple times on this issue. Several IG reports have been issued regarding delays in care and scheduling irregularities, including reports on Temple, Texas in January 2012, and up to the most recent and egregious report in September 2013 at the Columbia VA Medical Center. Two publicly released Office of Medical Inspector reports related to whistleblower allegations at Jackson VA Medical Center and the Fort Collins community-based outpatient clinics. Even more troubling is that with the numerous GAO, IG, and Office of Medical Inspector reports that have been released, VA senior leadership, including the Secretary, should have been aware that VA was facing a national scheduling crisis. VA's leadership has either failed to connect the dots or failed to address this ongoing crisis, which has resulted in patient harm and inpatient death. The question we must answer today is, even with all the information available to the Secretary starting over a year and a half ago, and specific instances of patient harm and death directly related to delays in care, why were the national audits and statements of concern from the VA only made this month? I thank the Chair. I yield back.
Thank you, Senator Burr. Senator Murray.
Well, thank you very much, Mr. Chairman. I'm really glad you called this hearings. Like most Americans, I believe that when it comes to caring for our nation's heroes, we cannot accept anything less than excellence. The government made a promise to the men and women who answered the call of duty, and one of the most important ways we uphold that is by making sure our veterans can access the health care they need and deserve. So while the Department generally offers very high-quality health care and does many things as well as or better than the private sector, I am very frustrated to be here once again talking about some deeply disturbing issues and allegations. It's extremely disappointing that the Department has repeatedly failed to address wait times for health care. So I was encouraged when you announced a nationwide review of access to care, and I'm pleased that the President is sending one of his key advisors, Rob Neighbors, to assist in overseeing and evaluating that review. His perspective from outside the Department will make this review more credible and more effective. But announcing this review is just the first step. These recent allegations are not new issues. They are deep, system-wide problems, and they grow more concerning every day. When the Inspector General's report is issued and when the Access Review's report is given, I expect the Department to take them very seriously and to take all appropriate steps to implement their recommendations. But there are also cases where the facts are in right now. There are problems we know exist, and there is no reason for the Department to wait until the Phoenix report comes back before acting on the larger problem. The GAO reported on VA's failures with wait times at least as far back as the year 2000. Last Congress, we did a great deal of work around wait times, particularly for mental health care. The Inspector General looked at these problems in 2005, 2007, and again in 2012. Each time, they found schedulers across the country were not following VA policy. They also found in 2012 that VA has no reliable or accurate way of knowing if they are providing timely access to mental health care. But now the IG recommendations are still open, and the Department still has not implemented legislation I authored to improve this situation. Clearly, this problem has gone on far too long. It is unfortunate that these leadership failures have dramatically shaken many veterans' confidence in this system. Secretary Shinseki, I continue to believe that you take this seriously and want to do the right thing. But we've come to the point where we need more than good intentions. What we need now is decisive action to restore veterans' confidence in the VA, to create a culture of transparency and accountability, and to change these system-wide, years-long problems. This needs to be a wake-up call for the Department. The lack of transparency and the lack of accountability is inexcusable and cannot continue on. The practices of intimidation and cover-ups has to change, starting today. Giving bonuses to hospital directors for running a system that places priority on gaming the system and keeping their numbers down rather than provide care to veterans has to come to an end. But, Mr. Secretary, it can't end with just dealing with a few bad actors or putting a handful of your employees on leave. It has to go much further and lead to system-wide change. You must lead the Department to a place where we prioritize the care our veterans receive above everything else. The culture at the VA must allow people to admit where there are problems and ask for help from the hospital leadership, from the VISN leadership, or from you. This is the time to make real changes. Thank you, Mr. Chairman.
Thank you, Senator Murray. Senator Isaacson.
Well, thank you for the call on the hearing, Mr. Chairman. Mr. Chairman, I'd like to ask unanimous consent that the complete statement of Senator John Boozman be entered for the record.
Without objection.
And also our best wishes for the committee for his speedy recovery from
Absolutely.
Mr. Chairman, could I ask unanimous consent that all members' opening statements be included in the record?
Of course.
Dr. Petzl, Secretary Shinseki, thank you for being here today. The Chairman has said we should not rush to judgment, and that's always true, but we should have a rush to accountability. Even before Phoenix, even before Durham, even before some of the other Cheyenne and Fort Collins, the others that have come to matter, we've already known, and the VA has admitted to at least 23 deaths that took place in part because of delays in GI consults. 7 of those were in my area, 2 in North Florida, 3 in Augusta, Georgia, 4 in Atlanta, Georgia, at the VA hospital in Atlanta, Georgia, all mental health issues. Dr. Petzl was in my state on August the 22nd of last year for a 2.5-hour hearing on the Atlanta situation. And we knew and determined then that it was problems with delays in setting appointments for mental health patients that caused an open period of time where, in fact, they took their life because of a failure to get the services they should have gotten. So while we need to complete the IG's report and find out every problem where things are wrong, we've had 50 IG reports since 2013. And in those reports, we find repeatedly over and over again where there has been a gaming of the system, where the system is more important than the patient. I think our veterans, and I think you, Secretary Shinseki, deserve better from the members of the Veterans Administration and the VA health system. I told you yesterday on the phone when you were generous enough to call and we had a long discussion, I think the veterans and yourself have been misserved by the senior management of the VA. We need accountability. What's going on in the VA is not a mystery anymore. We'll find out more from the IG's report, but I would hope we'd get an accountability in the chain of command at the VA, as in the accountability of the chain of command in the United States Air Force when I was in the service, where you're held accountable for your responsibility. Mistakes are not tolerated. One mistake might be tolerated, but the second mistake on the same decision should never be tolerated. I thank you for being here today. On behalf of all the veterans in Georgia and in the United States of America, let's get this right. Let's hold the system accountable. Let's make sure that no veteran dies because of a failure of the system to see to it they get appointments for the care they need when they need it. I yield back.
Thank you, Senator Isaacson. Senator Blumenthal.
Thank you, Mr. Chairman, and thank you very, very much for holding this hearing, which I hope and believe will be bipartisan and as non-political as it possibly can be. Let me thank you, Secretary Shinseki, for your service to our nation. Over many years, you have served and sacrificed for this nation, and I deeply respect and thank you for all that you have given to the United States of America, including in your 6 years as Secretary of the VA. And I know that you are determined, as the President is determined, to unravel and reveal any wrongdoing, to remedy any damage, and to restore trust and confidence in the VA healthcare system. And I agree with the Chairman that we should avoid a rush to judgment. But we have more than allegations at this point. We have evidence, solid evidence, of wrongdoing within the VA system, and it is more than an isolated instance of wrongdoing. It's a pattern and practice, apparently, of manipulating lists and gaming the system, in effect cooking the books, creating false records, which is not just an impropriety or misconduct, it is potentially a criminal act. And it is a pattern, as the chart submitted by the American Legion as Addendum C shows. There is a pattern across the country in more than 10 states of this misconduct occurring. In addition, there is a history. The GAO has reported, your own Inspector General has reported these kinds of problems in the past. So there is a need now for more than just investigation. There's a need for action to restore trust and confidence, to assure accountability and transparency. Our nation's veterans deserve the best medical care, nothing less. The situation now presenting serious, pressing, unanswered allegations and uncertainty is intolerable. And I have very severe and grave doubts that the resources now at the disposal of the Inspector General are sufficient to meet this challenge. I think there is a need for more than just the kind of appointment that the President has made of Rob Nabors to oversee the Department of Veterans Affairs investigation. There's a need for resources going to the Inspector General and possibly involvement of other investigative agencies from the Federal Government, because the resources currently available to the Inspector General simply may be insufficient. In addition, there are 3,000 job openings across the country in the VA. They're listed on usajobs.gov. I urge that positions relevant to access to medical care be filled immediately, and that action be taken to restore not only the transparency and accountability that we all expect from the VA, but also to deal with the disability claims backlogs that continue to plague the VA. The question now is, what does the evidence show? Is it criminal or simply civil? And that judgment has to be made as soon as possible. Thank you, Mr. Chairman.
Thank you, Senator Blumenthal. Senator Heller.
Thank you, Mr. Chairman, and Ranking Member Burr for holding this hearing today. I want to thank the Secretary and Dr. Petzl for also being here. The other witnesses, thank you for taking time to be with us today, and also for the veterans that are in the room with us today, those that may be watching this hearing. Thank you very much for your service. What has come to light about the VA in recent months has proven to Congress, to veterans, and to the American people that there's a real problem with accountability at all levels within the Veterans Administration. Poor management and care from the VA is also a problem that Nevada veterans are facing, and it's not something that is new, and in fact it's something I've raised repeatedly with the VA to no avail. I believe it's long overdue for this committee to exert its oversight and hold leadership within the VA accountable. Just last week, I sent a letter to Senator Shinseki asking for immediate answers about the lack of accountability on the local level and whether the VA leadership finally plans to do something about it. I look forward to receiving a timely response and action on the concerns that I highlighted. As Nevada's representative on this committee, I believe it's also my role and responsible to get answers for Nevada's veterans about the problems that they're facing with VA care and benefits. In Las Vegas, veterans have complained of excess wait times in the emergency room, which in itself is too small to meet demand. Just a month ago, the VA Inspector General investigated the VA's treatment of a blind female veteran who waited over 5 hours in the emergency room and later, 2 weeks later, died. The IG also found that a quarter of the veterans in the emergency room wait over 6 hours before receiving care. Furthermore, a Las Vegas veteran wrote me a letter recently and said he had to find care elsewhere because the wait time for an appointment at the VA was longer than 2 months. Given these concerns, as the VA completes its face-to-face audits of VA facilities, I want assurance that all of Nevada's VA medical centers and clinics will be thoroughly audited and that I will receive and be able to review the results immediately. As the co-chair of the VA Backlog Working Group, I'm also extremely concerned with the claims backlog in Nevada. Although the Secretary promised me that there would be changes, Nevada veterans are still waiting the longest, at 355 days on average, for their claims to be processed. When my office then requested the status of veterans' claims, the Reno VARO is unresponsive. It's unacceptable that local VA officials would limit any congressional office's ability to get answers for their veterans. Despite my repeated requests, these ongoing issues have not been resolved. At some point, I have to ask if these problems in Nevada are the demonstration of failed leadership at the top. VA leadership is not holding local officials accountable and is failing to care for those who sacrifice on our behalf. Promises to change and do better for our veterans have not produced results. I want changes. I do not want empty promises. If the VA continues on this course, I think it's ultimately time to look to the top for these changes. Thank you, Mr. Chairman.
Thank you, Senator Heller. Senator Hirono.
Thank you, Chairman Sanders, for providing this forum for us to drill down on the root of the many issues facing veterans hospitals and finding solutions to these problems. I certainly echo the sentiments of my colleagues in expressing concerns regarding the VA culture, the lack of enough accountability, the probable need for structural and system-wide changes. The veterans healthcare system is a promise that we made to America's veterans that we will take care of them in return for their service and sacrifice. The close to 10 million veterans that access care through the VA system need to trust that they are receiving high-quality care when they need it. And I do note 10 million veterans signed up for the healthcare system is huge. That is greater than the population of a number of states, including the state of Hawaii. When we fail to provide proper care for our veterans, we not only fail them, but their families as well. And these families have also sacrificed for our nation's security and provide essential care and support for our veterans. And while the immediate focus may be on the Phoenix case and similar allegations regarding a number of other VA hospitals, it is important to see what is happening systematically at the VA to provide veterans high-quality care. And so we must look at the totality of the VA system to see what is working and what is not. I look forward to hearing from the panel about exactly what the challenges and problems are, what actions have been taken, need to be taken to serve our veterans better. And while the VA Inspector General is investigating and Secretary Shinseki has called for a national face-to-face audit of the VA health system, my hope is that this first of a number of hearings by this committee will identify other changes that should be implemented. I look forward to hearing from you once again, Mr. Secretary, and the other VA officials on your plans to resolve the underlying issues and restore confidence in the veteran community, and very importantly, to listen to what the veterans community has to say about the changes that need to be made. Thank Thank you, Mr. Chairman.
Thank you, Senator Rono. Senator Moran.
Mr. Chairman, thank you, and Senator Burr for conducting this hearing. Mr. Secretary, good morning. I arrived a few minutes late this morning because I've just returned from the World War II Memorial, where a Kansas honor flight was there. Had conversations with Kansas veterans again this morning. It's a moving experience each and every time to have that opportunity to visit with our World War II veterans. And again, the conversation was the VA is failing them. Please make certain, Senator Moran, that that doesn't continue. Thousands of veterans across the country, but hundreds of veterans in Kansas visit with me on an ongoing basis, and they tell me they're struggling and suffering stories because of circumstances they find at the Department of Veterans Affairs. They would tell me that the sacrifice that they encountered, if they were willing to say this less than humble sentence, they would say, "Why can't we have the service that we earned and deserved?" And the reality is they earned and deserved that service, and in my view, the Department of Veterans Affairs is not providing those worthy veterans what we have committed to do. The sad story is that many veterans across the country, and certainly in Kansas that I speak to, have lost hope in the Department of Veterans Affairs and just believe that things are never going to get any better. Your announcement of a face-to-face review across the system, Mr. Secretary, I find lacking in what needs to be done. The reality is that we have had review after review, Inspector General report after Inspector General report, questions by this committee and the House Veterans Affairs Committee that as a result, as far as I can tell, has resulted in no action by the Department of Veterans Affairs. The idea that you can conduct a system-wide, as you indicate in your opening testimony, review of the VA using 220 VA employees and visiting 153 medical facilities. Mr. Secretary, we have 1,700 VA points of access to care, and you indicate in your testimony this will provide a full understanding of the VA's scheduling policy and continued integrity in managing patient access to care. I don't see a review that lasts 2 weeks using 220 employees and looking at 153 medical facilities as capable of providing that information. So I would suggest this seems to me to be more damage control than it does to be solving the problem. I actually think that we don't have the need for more information, although that's always welcome. What we need is action based upon the information that has already been provided to the Department of Veterans Affairs. I've served 18 years on the Veterans Affairs Committee. I've worked with 9 Secretaries of Veterans Affairs, and what is seemingly true to me today is that the quality of service, the timeliness of that service is diminishing, not increasing, and that wasn't true until recently. We have a significant number of veterans that we serve today, but Mr. Secretary, we can anticipate more as our military men and women retire from service in Afghanistan and Iraq. We have an aging World War II veteran population. If we can't care for the veterans that we are trying to care for today, how do we expect the Department of Veterans Affairs to care for those as the numbers and seriousness of their condition increase? So, Mr. Secretary, I look forward to hearing what you have to say today. I welcome that conversation. But in my view, an additional review by your department is not the answer. The answer is action by the Department of Veterans Affairs that changes the system that you are leading and changes the culture and nature of the folks that are your employees. I look forward to your testimony. I look forward to making certain that we keep our commitment to those who served our country. Thank you.
Thank you, Senator Moran. Senator Begich.
Thank you very much, Mr. Chairman, for holding this meeting, Ranking Member Burr, for offering an opportunity to have this discussion and oversight of the VA and the issues that are surrounding the scheduling, but also many other issues that the VA faces. Let me first say to our 2 panelists, thank you for your service to this country in both your ways that you have done. But Secretary Shinseki, immediately after the Phoenix story broke, I sent a letter very quickly because I was outraged, unbelievable what I was hearing. But now, after a few weeks, it's now become a systematic issue that I've now seen in others, as you've indicated through your own conversations that I've had with you, that it seems to be an issue that is occurring in other VA clinics. I will say, from a state that has 77,000 veterans, the highest per capita in the nation, it is impactful in determining where they get their care. We've been fortunate, to be very frank with you, the work we've done with the VA to be able to create access to our Indian health care services that has been able to cut some of that wait time out, but get better service throughout the state. But when we look at veterans, may they be in Alaska today, tomorrow they might be in Arizona, tomorrow they might be in North Carolina. So the service that's being delivered is critical, that we figure out the systematic problem. And I do agree with my colleagues here that we have report after report after report. I've been here now a little over 5 years, and all I've seen is GAO reports and other reports that always indicate systematic problems that we need to correct. So I am going to be anxious for your commentary as well as others on how we're going to fix this once and for all. And I know you've been burdened in some cases because we've had 2 wars, and the VA started to be funded aggressively in the last 3 or 4 years after we've already started to wind down in Iraq and now Afghanistan, which has caused a lot of pressure. So I need to understand how that's impacted some of the work of the VA. Also, as you look at the issues and you examine what we need to be doing, I want to know from your perspective, what are things that we're doing through more regulation or more laws that are creating more hurdles and red tape? If there's stuff that we should be eliminating to create a more streamlined process, I want to know that. But to not have the service delivered at the highest level to our veterans is a disservice. They earned it. They fought for this country. They served our country. We need to do everything we can to make sure the service is delivered at the highest possible level. So today will be a little contentious, no question about it. I hope tomorrow that we take what we've learned today and move to increase the capacity and increase the performance of the VA. I thank you both for being here, but I will tell you I was outraged and unbelievable what I'm now seeing over the last few weeks. But I'm anxious to work with you to get our veterans the best care possible, as we have started to do aggressively in Alaska in a very unique arrangement with our Indian Health Care Services and the VA, which I think is delivering better care than ever before, but more work to be done. Thank you, Mr. Chairman.
Thank you, Senator Begich. Senator Testa.
Yeah, thank you, Senator Sanders, and Mr. Chairman and Ranking Member Burr for convening this hearing. I want to thank the witnesses for being here, this panel, and the next two. You know, as an elected official, the most meaningful and most difficult decision I confront is a question of sending men and women into harm's way. And Montanans tend to list in high numbers. We have the second highest per capita of veterans in our state. It's a very personal issue for me, and it's why I'm very proud to serve on this committee. And I'm encouraged that folks in Washington are subtly interested in access to health care for veterans. In most cases, this is long overdue. Before I got here, the VA didn't even have mandatory funding. They certainly didn't have forward funding. So this is a topic that many of us have been trying to address for years. And given my close association with veterans issues, I'm approached by veterans every time I go home, and that is almost every weekend. And an overwhelming majority of those folks are appreciative of the care of VA in Montana. And when they have issues or concerns, they are not bashful, as veterans are not, about telling me about it. And when I get back to my office on Monday, I work on those concerns, often with you two. The allegations that they hear and the allegations that I am hearing now are very troubling. If any of these allegations in Phoenix or elsewhere turn out to be true, swift and appropriate action needs to happen. If the issues are systemic, we need to make some fundamental changes, and we need to make them now. If the issues are about employees' misconduct and competence, specific heads should roll. And now, in order to move forward effectively and smartly, we do need the facts. I hope we get those today, in part. And if we're truly interested in honoring our veterans by doing them right, the facts will drive a productive conversation about access to health care for our veterans. So let's talk about the ways we can address the VA medical workforce shortfalls, particularly in rural areas. Let's talk about ways we can improve transportation options for veterans or expanding telemedicine initiatives. Let's talk about buildings and partnerships between the VA's local providers and providing the VA with the resources it needs to address its patient workloads. Let's have these conversations so that we can provide veterans with meaningful action items, not just political talking points. Veterans deserve our best. They have sacrificed much. Let's demonstrate our best by having a productive, constructive, truthful conversation about what needs to be done to fix the problems that are out there in our VA. Thank you, Mr. Chairman.
Thank you, Senator Testa. Senator McCain of Arizona is not a member of this committee, but given that very serious allegations have been raised about treatment in Phoenix, Senator McCain requested to come before the committee, and we welcome him today. Senator.
I thank you, Mr. Chairman. I want to thank you for the opportunity to make a brief statement this morning, particularly given that many of the serious allegations that will be discussed at today's hearing involve the treatment of veterans in my home state of Arizona. Since our nation's founding, Americans have been fighting in faraway places to make this dangerous world safer for the rest of us. They've been brave, they've sacrificed and suffered. They bear wounds and more losses they will never completely recover from, and we can never fully compensate them for. But we can care for the injuries they suffered on our behalf and for their physical and emotional recovery from the battles they fought to protect us. Decent care for our veterans is the most solemn obligation a nation incurs, and we will be judged by God and history how well we discharge ours. That's why I'm deeply troubled by the recent allegations of gross mismanagement, fraud, and neglect at a growing number of Veterans Administration medical centers across the country. It's been more than a month since allegations that some 40 veterans died while waiting for care at the Phoenix VA were first made public. To date, the Obama administration has failed to respond in an effective manner. This has created in our veterans community a crisis of confidence toward the VA, the very agency that was established to care for them. At a town hall forum I hosted in Phoenix last week, the families of 4 veterans who passed away in recent months stood before a crowded room to tell their stories. With tears in their eyes, they described how their loved ones suffered because they were not provided the care they needed and deserved. They recalled countless unanswered phone calls and ignored messages, endless wait times, mountains of bureaucratic red tape, while their loved ones suffered debilitating and ultimately fatal conditions. No one should be treated this way in a country as great as ours. But treating those to whom we owe the most so callously, so ungratefully, is unconscionable, and we should all be ashamed. Since the initial reports in Arizona last month, we've seen this scandal go nationwide, surfacing in at least 10 states across America. Secretary Shinseki has ordered a nationwide audit to look at the management practices at VA medical centers. Several employees have been placed on administrative leave, and the VA Office of Inspector General is investigating the Phoenix VA. I respect the important role of the Inspector General, but my fellow veterans can't wait many months it may take to complete its report. They need answers, accountability, and leadership from this administration and Congress now. Clearly, the VA is suffering from systemic problems in its culture that require strong, reform-minded leadership and accountability to address. At the same time, Congress must provide VA administrators with greater abilities to hire and fire those charged with caring for our veterans. Most importantly, we must give veterans greater flexibility in how they get quality care in a timely manner rather than continue to rely on a department that appears riddled with systemic problems in delivering care. How we care for those who risk everything for us is the most important test of a nation's character. Today, we are failing that test. We must do better tomorrow, much better. For the 9 million American veterans enrolled in the VA today, and for the families whose tragic stories we heard last week in Phoenix, who I know are still grieving their losses, it's time we live up to Lincoln's injunction, which serves as the VA's model today, to care for him who shall have borne the battle, and for his widow and his orphan. As I said, it's time for answers, accountability, and leadership from this administration, and I look forward to hearing from Secretary Shinseki. I thank you, Mr. Chairman, and I thank Ranking Member Burr and the members of this committee.
Okay. Thank you, Senator McCain. I would like to now welcome retired U.S. Army General Eric K. Shinseki, Secretary of Veterans Affairs, to the first panel. As I think most people know, Secretary Shinseki is a graduate of West Point, served as the Chief of Staff of the Army from 1999 to 2003. He retired from active duty in 2003 after a nearly 40-year career in the U.S. Army. Following the September 11th 2001 terrorist attacks against our country, Secretary Shinseki led the Army during Operations Enduring Freedom and Iraqi Freedom. He previously served simultaneously as Commanding General, United States Army, Europe and 7th Army, Commanding General, NATO Land Forces, Central Europe, and Commander of the NATO-led Stabilization Force, Bosnia-Herzegovina. And I want to also note a few of the many awards that Secretary Shinseki received during his career: the Defense Distinguished Service Medal, the Legion of Merit with oak leaf clusters, the Bronze Star Medal with V device with 2 oak leaf clusters, and the Purple Heart with oak leaf clusters. Mr. Secretary, thank you very much for being with us today. Secretary Shinseki is accompanied by Dr. Robert Petzel, who is the Undersecretary for Health. Mr. Secretary, your prepared remarks will be submitted for the record. What I would like to do now is if both of you could rise and take the oath.